Amazing.
Hi, everyone, and welcome to the Community Engagement Series. My name's Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S. H. Leong Center for Healthy Children, as well as your moderator for the series. I'm incredibly excited to introduce our speakers for today's session. We're joined by Dr. Michelle Phoenix, who's an associate professor in the School of Rehabilitation Science at McMaster University, as well as a CanChild Scientist. She's practiced clinically as a speech language pathologist and holds an adjunct scientist position with Kids Ability. Her research focuses on improving access and equity in children's rehabilitation services, and this includes topics of family-centered care, cultural responsivity, and trauma-informed care, as well as parent well-being and innovative methods of service delivery. She works with a variety of community partners and studies ways that we can include often excluded populations in service design, delivery, and evaluation. We're also joined by Logan Wong, who currently works at McMaster University as a research assistant within the School of Rehabilitation Sciences, as well as an entrepreneur and the owner of IDEAA Perspectives Training and Consulting, which is a consulting firm specializing in inclusion, diversity, equity, accessibility, and anti-racism. So today's presentation is really going to challenge us to consider who is often left out of research partnerships and how we can meaningfully broaden our reach. So welcome to our presenters, Michelle and Logan. I'll now pass it off to both of you to lead your presentation.
Thank you, Priscilla, for the warm welcome and introduction. Logan and I are both going to introduce ourselves in a little bit more detail in just a moment. So I'll start screen sharing. Thanks, Priscilla, for continuing to admit people. Um, I know we're over the lunch hour, so please feel free to eat, move around, do whatever you need to do. Have your screens on or off. The way my situation is set up, I'm not able to see everybody at the same time. So if at any point during the presentation you'd like to stop us, add something, if you can raise the virtual hand using the Zoom feature, it'll pop you to the top of the screen. And I know Priscilla is a wonderful moderator who can help to catch any comments that come through the chat or virtual hands raised. So please feel free to do that throughout. Otherwise, Logan and I have prepared to leave at least 15 minutes towards the end of the presentation for open discussion, questions and answers. So as noted, the title for our presentation today is Advancing Equity in Childhood Disability Research Partnerships with Often Excluded Children, Youth, Siblings, and Caregivers. And it's a grounded theory study kindly funded through SSHRC, an Insight Development Grant. And before I begin this presentation, I'd just like to acknowledge that McMaster University, where I'm currently situated, is located on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon Wampum Agreement. And I like to personalize these not recommendations, these reflections for all of the talks that I give. And so what I've included on the right-hand side is a photo from the Institute of Applied Health Science. It's a piece of art that covers a whole wall. It's a mural in our building. And this is just a piece of it. It's done by Kyle Jodick, who is a Cayuga Turtle Clan artist from Six Nations of the Grand River. And in the 1 minute video that's linked there, and we can share the slides, Kyle discusses what this piece of art means to him, and it also includes members of our school talking about our commitment to truth and reconciliation, which for me, part of that is learning from the ancestors and the Indigenous peoples of our land. So something that Kyle depicts in this beautiful mural is those lines. And if you see the full thing, the lines interconnect different generations of people who were sharing knowledge with one another. And he said it represents the seven grandfather teachings. So I looked up what those were. There's a link if you want to learn more. But I just included some keywords that related to the teachings and the content of today's presentation, which are love, respect, bravery, truth, honesty, humility, and wisdom. And those aren't words we always hear in academia or connected to research, but they definitely are connected to partnerships with often excluded populations. So I'll just share a little bit more fulsome introduction to myself and my positionality in doing this work, and then I'll invite Logan to do the same. So one of the roles not mentioned in that bio was I'm a mother to three kids, and I tend to introduce myself that way because my research is focused on families, and I really try to take a family-centered lens to all of the work that I do. I've practiced clinically as a speech language pathologist, and now my work is primarily in education and in research, but I really try to focus that research on how do we engage families in clinical service, how do we engage families in the design, delivery, evaluation of services, and in particular, which families might be left out. So I think you'll see that reflected in the work today. Logan?
Hi, my name is Logan and my pronouns are he, him. Um, I have a background in social work. I have both my bachelor's and my master's from Toronto Metropolitan University, and I specialized in EDIA as my bio said um, within that coursework. And I've been working on this project as a youth partner with Michelle for um, almost 3 years now. And I'm really excited to be here today to present our findings.
So in a nutshell, we're going to start with just an overview of the study. We'll share a little bit more about our team members, the purpose, research question, etc. We'll share a little bit about the methods. Priscilla and I both really like qualitative grounded theory, so I've tried to rein it in for this presentation, but if you're curious about more details, please let me know. We'll share our initial or our interim findings. This study is ongoing, so what you're going to see is a work in progress. We're happy to have your feedback on the work as it's evolving, and I'm sure it's going to continue to change as we collect further data. Logan's going to share some reflections about the ways in which our team has worked together with himself as a youth partner. We have a sibling and a parent partner on our team as well, and how that connects to our findings. We'll share some next steps and save some time for discussion.
So now we'd like to take you through the study overview. Um, so you can go to the next slide and we can introduce you to our team. So not everybody is in this photo, unfortunately, but Michelle is the lead researcher, and then the youth partner, and then Ali is our trainee and also research assistant, and Marion is our parent partner, and Sam Machinsky is a co-investigator and researcher, and then Lisa is a sibling partner, and Laura is our research assistant and student. Um, and they've all been involved in our team at various points, and they've all been a um, very good contributors to what we're going to show you today. And so on a point on language, we just wanted to preface this by saying that we use the term disabled instead of with disabilities or exceptionalities. This is based on the feedback from our community and their preferences, including the participants within our research. And we respect that different people have different views on this, and we are open to discussion about it. And then we use the term often excluded groups, which may also refer to, as you've heard, equity deserving groups or marginalized populations. You can go to the next slide, Michelle. So in childhood disability research, often excluded groups include disabled children themselves, fathers of disabled children, youth and individuals who are racialized, English language learners, and immigrants, members of indigenous community, or people who identify under the queer umbrella, those with low income and low literacy or experiencing mental health challenges, or are residents of rural or remote communities. And we'd like to focus your attention on this wheel of power and privilege, which just demonstrates that we look at both our participants and our partners and the people on our research team from a holistic perspective. And we think about how their identities intersect. You can go to the next slide. Yeah, so next I will go through our inclusion criteria, and for the purpose of the study, young disabled children constitute as their own often excluded group, but other participants include disabled youth, their siblings, parents, and caregivers, and researchers who work with them. And then they also can and must belong to an often excluded group in order to participate. Children and siblings are between the ages of 8 and 12 and must have experience as participants or research partners. And then all the other groups can also be partners in research, but not necessarily participants. And then our disabled youth is between the ages of 13 and 21. And then one thing I like to mention is that we include disabled youth and also people who have health conditions, so not necessarily disabilities, but also experiences within healthcare for specific health conditions as well. You can move on to the next slide. On this slide, I will go through the study purpose and the question that we're looking at. So our question is guided by how do often excluded disabled children and their family members and researchers engage in childhood disability research partnerships. And the purpose of our study is to address the lack of inclusive and representative engagement in childhood research, to develop a theory that explains the process of engaging these populations in research, and to identify specific constructs of research engagement, how they relate to one another. You can move on to the next slide. And then next, Michelle will go into the methods. Thanks, Michelle.
Okay. Okay, so I contained my enthusiasm about qualitative grounded theory to one slide. So it is a qualitative study. It's called a constructivist grounded theory, which is very inductive in our approach. We've used snowball sampling because we're trying to, as Logan noted, reach out to partners who are often excluded. Blanket approaches to sampling aren't going to work very well. So we needed to start with people that we knew who were actively partnering with people from often excluded group if they were researchers, or partners that we knew who fit some composition of those many often excluded categories to directly invite them into our research. So Ali created something really fascinating that I'd never seen before called a heat map. So we were trying to sample across children, youth, um, siblings, caregivers, and researchers as four aspects of variation, and then also all of those different often excluded categories, so including rural families, fathers, people who speak languages other than English, etc. So we're really aiming for diversity among our sample. In terms of data collection, we're doing semi-structured interviews with demographic surveys. For data analysis, as I mentioned, it's very inductive. So starting with transcripts or de-identified transcripts and developing a coding structure from there. We do the data collection and the data analysis in tandem with one another so that we can use the ongoing analysis to shape the questions that we're asking. We're trying to achieve something called theoretical saturation. So as we see important constructs emerging, those might be things that we ask people more about, or we look for people who might have a particular set of experiences to help us understand those things. Ali's been our primary coder, but we work very closely to iterate the coding structure together, and she consistently brings her ideas forward for full team discussion that includes all of our team partners. And then we'll go through something called triangulation. So we're looking across people with varied roles to understand things from multiple perspectives. And you'll see that in the quotes that I present today. We engage in reflexivity with all of our team members. Logan might speak to this later as a reflection on our process, but at every meeting, we include aspects of audit trail, so noting what all team members had done on the project since the prior meeting, reflecting on things that we're learning, the ways in which we work together, and things we might want to change, and things we appreciate. So far, we've enrolled 30 participants in the study, and if anybody on this line, actually, I think some people have participated in the study, so we are so grateful for that. Thank you very, very much. We're aiming for approximately 40 participants, but again, it will be up to theoretical saturation to determine when we've, as fully as we can, understand the constructs that we think are important and the relationships they have with one another. So recruitment is ongoing, but so far we've included 3 disabled children. You're going to hear me say it for next steps, but if you're thinking through this presentation, oh, I know so-and-so who might be a good fit for this study, please let us know. It's very tricky to recruit disabled children who have participated in research. So we're looking to do more of that. We've so far had 5 disabled youth from often excluded groups. We've had a mix of siblings and parent caregivers from often excluded groups. We've had far more parents and caregivers than we have siblings. So again, if you know siblings who have participated in research as a partner and are part of an often excluded group, we would love to hear from them. And then we've had 12 researchers participate. I should maybe just pause there before I jump into findings. Are there any questions, any points of clarification thus far? Okay, I'm watching the chat and I don't see any virtual hands, so I think we're okay to move into findings. So you'll notice in brackets, we've called it an interim process of engagement because, as I noted, this is ongoing. So what you're going to see today is not likely to be the final iteration of these set of results, but they're holding steady so far. You kind of, in grounded theory used something called constant comparison. So every new piece of data, we're checking back to see if it fits or if it challenges our existing conceptualization of this theory. So far, this is what's holding true. There is sort of a linearity to this process, or is the thinking in sequence about who is, in brackets, not being engaged. So obviously people who are participating have to have been engaged so as to reflect on that in their conversation with us. But a lot of what they reflected on is that they feel sort of lucky or chosen, or, it's been haphazard how they got into research, and that they worry or fear, or they're participating because they recognize that not all people have equal opportunity to participate in research. People shared a lot about their motivations for engaging in research. This next bullet, how are people engaging, is probably our meatiest category right now. I'll break it down into a couple of components, and then we'll reflect on what are the outcomes of engagement. So in terms of who is not being engaged, we're going to have all of our demographic survey data in terms of those often excluded categories that people identify being a part of. That's not what I'm talking about here. Here, this is what people verbally told us was really important about how they identify the kinds of projects they choose to join, the depth or number of projects that they might have been involved in. So we had everybody saying, I've only participated in one little thing, to I've been a partner on 27 different projects. The other thing that was really interesting, and you'll see it come up in existing literature, is that people often wear multiple hats, or they have multiple roles. So they might be a caregiver and also a researcher, or they might be a member of an often excluded population and also bring that to their research experiences. So there was some complexity in terms of how people answered, depending on what role they were most identifying with in that moment. So you'll see it reflected in some of these quotes. One of the parents said, "A lot of research that claims to represent parents is really just representing mothers, and that's a problem." So they identified fathers as an often excluded group, or other caregivers. People coming from minority representation groups are not well represented in many forums, even in researcher forum, even as a patient partner or youth partner, or other partners too. I don't see that. So thinking not just about the partners that we invite into our team, but diversity among the researchers themselves, the kinds of work that we do. This one's about language and who might not be included. So they said, it's a youth who said, basically, "I did not know English at that time, and I only had to take French. And so with French, most cards, they were doing app development. So that's what the cards are referring to. Most cards were not working, or the text was just completely wrong. And it was really annoying trying to figure it out. I had to figure it out by the images at first, and then I told them to fix it, and they did fix it. But just at the start, trying to test the app was quite a nightmare." And you're going to see language reflected again later as we talk about communication and the importance of that. And then the last quote, this youth said, "Yeah, it depends on what you're talking about, because I'm multiply marginalized. So it depends on what you're talking about in terms of what kind of group I would talk about." So people talked about those multiple hats, multiple roles, in a couple of different ways. One, thinking about intersectionality. None of us is just one thing. So you might experience marginalization because of multiple aspects of who you are, and also the roles that you hold, as I mentioned earlier. Okay, so that was sort of the beginning with who's even invited to engage. But then people talked about their own motivations for pursuing engagement in research. The first two quotes are from a parent and a youth who talk about wanting to make a difference. Sometimes that was based on their own life experience or their clinical experiences. And we've seen that before in other studies, that even if we ask people about their partnerships in research or engagement in research, they sometimes flip back into talking about clinical encounters and their engagement with their child's health services, for example. So this first parent said, I had such a negative experience with navigating services. And then I was like, what can I do to make a difference? And the youth said, I like being able to share my experiences and it being used for something good to change the system for the better. And I hope you keep these things in mind as we wrap around and talk about the impacts of the research and whether those were perceived as positive or negative, because the reasons for people engaging in research were really wanting to see some tangible clinical change. The second one is a little bit more about what people themselves get out of participating in the research or their motivation for doing so. I should say partnering, not participating, to explore ideas and to expand their network. So one of the youth said, probably the most fun is that you get to try, for most research in general, you get to meet or try new things and new people. And I really liked, we had a couple of children, and one of the children said, yeah, my mom asked me, and I did it. Like it was just that simple, but it actually made me reflect on how it is that we find children to participate in research. And often it's because their parents are already connected or networked in some way. Okay. So this is the meaty one that I mentioned. So how are people engaging? There seems to be these three overlapping aspects. So one is about reach, one is about defining roles, and the last one is about principles. So in terms of reach, people talked a lot about how they themselves found this kind of convoluted pathway into partnering in research and how they worried that that pathway wasn't accessible to other people. So one parent said, I do see, for example, and maybe this is a question later on, maybe I'm jumping too far ahead, but I do see that some researchers continue to use the same patient partners over and over again. But I think it's because it's easy. And you see that reflected in the research as well. This concept of super users or parents or people with lived and living experience who get tapped repeatedly, and they have almost a professional identity around partnering and research. And this parent said, but sadly speaking, I felt that researchers were not reaching me. So often people had to take the onus on themselves to be able to find and sort of advocate for these opportunities to partner in research. Okay. There was also this aspect of defining roles in research. And I'm not sure that that language is going to stick, but there's this element of what people conceptualize as research itself, what they conceptualize as the role of a partner or their role on a team. There seems to be a need to explicitly discuss what the research project entails, what you could produce out of that research, and what the roles of all team members are. Often it seems like those things are a little bit taken for granted or glossed over. We might presume that people all have the same understanding of even what research is or what partners' roles could be, but it wasn't born true that everybody has that same understanding. And then it was linked to this idea of whether or not people are providing training or onboarding when we invite people to participate in research. So one of the children, when asked, said, like, what does research mean to you? What is participating in research? And they said, it's like if you ask questions about something and try to find the answer. Youth were talking about their own experience and being ready to take on and understand what a partner role could be. So they said, because I've had more medical experiences, I'm able to catch on a bit more. But I think people who haven't, I think it's way harder for them. And a parent saw their role as sort of being able or willing to bring forward ideas that other people might not. So they said, so I try to be that person to bring it up and state the uncomfortable. So that's sort of where I see myself in that role. Okay, and this is a really massive one, and it's still evolving, but how are people engaging and what are the principles underlying that engagement? Um, the first one, and I'm going to go through each one of these separately, but the first one is fostering trusting relationships. The second, they're not actually in any particular order at the moment, is creating psychological safety, positively communicating, and then applying meaningful and inclusive practices. So, under fostering trusting relationship, what really sort of came through in the data was this idea of humanism, of connecting as people, having building trust and showing people mutual respect, being empathetic and showing compassion in the ways in which we engage with other people. So, I've just again selected a couple of quotes to highlight this. So, a parent says, it all depends on team dynamics, how you're embracing your partners with compassion, respect, dignity, and honesty, and empowering them and embracing them equally as true partners with love, with compassion. I always use these terms. And the researcher said, I just think there's a lot of, a lot of barriers to racialized families wanting to work with us that are probably rooted in a lot of lack of trust and maybe a historical context of betrayal and not knowing how the research will be used or who it'll serve. I think that one leads us really nicely into this concept. Again, I don't know if this language is going to stick. We had a very meaty team discussion about it yesterday, but creating psychological safety. And that means in part being trauma informed, so recognizing past trauma, also the stigma that might exist within a community that we're engaging with. We have to be aware of our own power and privilege, and in particular, how that might relate to other people who are members of our research team. People talked about feeling imposter syndrome, and that's not just because of people's roles, but also because of our identities and what might be, if we're talking about often excluded populations, you might be the first of to be invited to a particular space, or we're often the onlys in a particular space, which can contribute to these feelings of imposter syndrome. It means, in part, recognizing the emotional, especially emotional exhaustion, but also time demands that exist in people's worlds and how much we might be layering on top of that when we ask them to partner in research, and to check our own biases and assumptions. So a parent said, one thing I've learned in this is that a lot of people with children who have chronic conditions show symptoms of post-traumatic stress disorder, and they may not want to go back to those bad places. The people who do get involved will tell you, and this is interesting, they still have issues like not wanting to go to a certain part of the hospital or talk about a certain issue. And a researcher said, and then I think just coming back to like sustainability of relationships, we did a lot of checking in with families afterwards, like how they're feeling, how they're doing. In terms of communication, we heard that especially the researchers need to be active listening and have approached these interactions with curiosity and humility, and not just sort of listen, but also reflect and be responsive to what you're hearing from your patient partners. Otherwise, things can become quite tokenistic. When communicating with partners, especially, we need to think about which language we're communicating in and whether that's accessible to the people that we are partnering with, including the terminology. So academia is famous for complex jargon and lots of use of acronyms. So trying to break that down to make sure that everybody can understand what's being talked about. And then some really pragmatic things, such as the timing of communication and the means of communication. So one parent said, I think it's like a little contract with the board of directors, maybe. I don't really know, uses the terms of reference, but it's an outline of what you're going to do and how long you're supposed to be a part of the team. So some of those tangible, concrete strategies to promote shared communication and expectations on the team were really valued. And a researcher said they have a few platforms to connect, but even more in French. Most of the connection for me is in English. It's sad, but it's better than nothing, so language is a barrier. Okay. And this is the last one of the principles, which is applying meaningful and inclusive practices. I'm not going to go into as much depth on any one of these things as we possibly could in the interest of time, but there's a lot of literature, I think, now about compensation in research and how important that is, especially when you're working with often excluded populations. Flexibility in terms of means of inviting participation or partnership on your team. We're learning a lot about tailoring research opportunities to include kids. Part of that is learning by doing and trying to engage kids in our own research. It's important for all team members to include aspects of critical reflection in your work. The creativity and arts-based methods are coming out as really valued and important in terms of allowing for a broader range of participation in research. And people talked about the depth, again, sometimes related to tokenism and what we're asking or not asking people to do as a part of their partnerships. So just a last couple of quotes on this. A researcher said, and they also like the flexibility. For example, in meetings, it's okay if they can't join on their laptop. They can call into the Zoom meeting, and while they're driving or walking, they can join in on the meetings, and I can follow up with them afterwards or anything they might have missed. And the last one's about arts-based methods. And they said, I think people find the art space like there's just a very big appetite for that. And although there can be a little bit of fear and trepidation at the beginning, I really feel like I see people blossom and bloom. And then I get a lot of positive feedback on the merits of a highly creative approach in the academy. Being mindful of time, I'm just going to keep us moving through to the outcomes of engagement. And I pose these more as questions that arose from our research. So one thing we realized is that sometimes the outcomes of the research or of the partnership aren't known to the people who have partnered. So when we asked them, can you describe some positive or negative outcomes of this research? A lot of people just didn't know what the outcomes had been, which was telling in and of itself. We needed to ask about both positive and negative outcomes. When people talked about positive outcomes, they talked about making change in lots of different domains. So at the level of service delivery, in terms of policy, etc. When people talked about negative outcomes, they either weren't sure what the outcome or impact of the work had been, or they were worried that they themselves hadn't had any impact on the research at all, which again spoke to tokenistic practices. So on the right-hand side, you'll just see a couple of supporting quotes. One of the parents said, so I don't know, to be honest, what's going to be done with that information. I'm hoping, some of the information they gathered will be applied to improve resources, but I don't know for sure. And another parent said, almost the contrasting opinion was that they're all very, very important. They're going to make a difference in policies. And a sibling was just happy to have their voice heard. So they said, but really oh, we finally get to have a little piece of voice in this. That's really quite important. Logan, I'll turn it to you for a reflection on our project and our findings.
Sure. As Michelle mentioned earlier, at the end of each team meeting, we have this reflection document that we fill out with what people have been doing between meetings and how they've been supporting the project. That's also what we appreciate about each other and how we can improve our team dynamics. And I that's the first time that I've been a partner on a project that does that. And, considering that I've been a youth partner for almost 10 years now, that is saying something about the reflective process that we go through as a team, and I'm just really grateful to be part of this team. And even in other presentations about patient partnership, when I'm asked about positive experiences or reflective experiences that I've had, like I always reference this team because honestly, it feels like you know, I think that happens when you spend a lot of time with people, but um, I think we've developed very strong friendships and very strong relationships within each other, and I don't think I can cite any other team that I feel that way about. So I'm just very grateful to be on this team with you, Michelle.
Thanks, Logan. It's just such a wonderful team to be a part of. You can tell by lots of the spin-off projects that have come about because of these relationships and shared interest and value. So I have to congratulate Logan and our team member, Ali Minnook, who's not able to join today, but has done like the lion's share of this project. She's fabulous. They received a Child Right Training and Innovation Fund to create modules that will support child and youth engagement in research specifically. So those are under development right now. We have a new child partner on that team, which is pretty fabulous to be engaging in that new way. Samantha Machinsky and I are co-creating micro-credentials with the McMaster Equity-Based Co-Creation Center group. So if anyone's interested in doing that, we have an ambassador level training course that's nearly ready to run. And the focus of that is to support co-design with people from often excluded groups. Sam Machinsky and Logan do you want to speak to this one, Logan?
Sure. Yeah. Um, Sam and I are working on a family engagement research course cohort that is specific to youth. Um, that's um, through the youth engagement and research course, but specifically for youth. And this is our first cohort um, this this year, and I have the privilege of being a co-instructor, and I can honestly say it's going very well, and I'm very excited to see future cohorts coming out of that, specifically for youth.
That's amazing. And I see Andrea Cross on the line too, who'd be involved in that project. And I mentioned earlier that our data collection and analysis for this project are ongoing. We're especially interested in recruiting more children. So we're looking for children 8 to 12 who have participated in research directly and their children with disabilities. And we're looking for siblings, in particular those from often excluded groups. So if you know of anybody who might fit those criteria and be interested in participating, that would really help us to wrap up our recruitment and move into our last stages of analysis. So with that, I've included emails for both Logan and I on this slide. Feel free to follow up, but we do have some time for open discussion as well.
Thank you so much for a great presentation, Michelle and Logan. I was taking notes as you were going through of things I'd like to reconsider in my own work, as well as things I'd like to bring to our members at the center. At this time, I'd like to ask if anyone on the call has questions to please raise their virtual hand. You're also welcome to leave your comments in the chat for our speakers, in which I'll keep an eye on that as well. And I see we have our first raised hand. Please feel free to unmute yourself.
Hi, everyone. Can you guys hear me okay?
Yes.
Perfect. Thank you. So first and foremost, thank you so much for the informative discussion and presentation. And also, off topic but not really, thanks to whoever enabled captions. That really helped a lot for me. I guess my question is, when it comes to engaging with people who aren't always included in research, how do you, I guess, break down those barriers or silos that people would, obviously put up because they're not engaged? Like, do that research, because obviously people might come up with like these notions that, oh, you guys just could be using me for your data or for like your project, and then you're going to leave us behind. So what are some like tactics or things you bring up in discussions that like have people know that they're going to be well taken care of and stuff like that? if that makes sense.
Yeah, it makes great sense and it's a great question. And you reminded me that there was something that I forgot to say on a slide. It was there, I just forgot to say it, which is to take time in doing partnered research with often excluded groups. And it's such a key thing to take time to understand someone's motivation for participating in the research. So you can't, as a researcher, just go in with your own agenda. It's really taking time from the outset to learn about what's important to the community that you might be engaging with, and to be honest about whether the research that you could conduct together might be able to achieve those outcomes, or maybe it's a building block towards those larger outcomes. I think we need to be careful not to overpromise to communities, because that is quite extractive. And can be tokenistic if people engage because they think you're going to be able to achieve some grand thing, but there's no way that you're anywhere close to that yet. I think we need to be transparent about that. And then I think the relationship piece is just so important. So taking the time to understand someone's personal motivations, what they hope to see for themselves in that partnered role, being able to provide training or onboarding if they're new to this space so that they understand what a partnered role could even look like. Because we find often people confuse maybe the participant role in research and a partner's role in research. So helping to understand what that could be on your project team. And then the pieces Logan mentioned about being reflexive all the way through. So if somebody's not enjoying or not fulfilled by their role, getting to know that way early on so that you can make changes in how your team functions versus waiting till someone's disgruntled at the end of a project because it didn't do what they were hoping it would. I don't know. Logan, did you want to add? Did I capture it?
Yeah, I think you captured it. I think um, something that I preach all the time when I talk about patient engagement is the importance of building those relationships. And I think you did mention that, but I just want to reiterate how important like building trusting and respectful relationships within your partnerships is like essential um to continuing that um professional and personal relationship with the person, and making sure that they feel supported and a part of the team.
Thank you.
Thanks for such a great question. I just want to check in with those on the call if there are any additional questions that you'd like to pose to our presenters today. Again, please feel free to raise your virtual hand. Andrea, go ahead.
Excellent presentation, Michelle and Logan. I've been watching your project from a distance, so it was really nice to be able to learn more about it today. I was really interested in the engagement with children piece and building off that last question there about, the importance of building relationships. I wondered if you could talk about what does that look like in terms of your building relationships with children in terms of partnering and research and from your experiences today. I know that you're early on in child engagement, but wondering if you could share.
Yeah, I think for child engagement, we have one of the spin-offs of our projects is the Training and Innovation Fund that we received to create those modules that Michelle mentioned, and I and Ali are project leads on that, and we have just recently engaged a 9-year-old or 11-year-old child, and I think like we just had one meeting, so I am just learning, but I think I think what we were learning from that experience is to make have a combination of like asking them direct questions about the research, but also having a little fun. So Al and I have created some games and based on their interests, like we did like a trivia game about birds because they really enjoy birds. Um, and then also to not underestimate how much they already know about research, even if they haven't participated or partnered as a child. Like in our first meeting, I was really impressed with how much this child knew about research in general and how it disseminates into other communities. And so I just going into those meetings with an open mind and not underestimating be, based on age. So
Yeah. The only other pieces I would add is we needed to do some thinking about assent for participating in our research and the child's motivation for doing so. So the one quote was like, "My parent told me to do it, so I did it," which is, probably the life of a child. But we are really trying to understand what it is the child themselves would want to get out of this research experience. So sometimes I wish Allie could be here today. It's like checking out their pets because that's what they want to show you in this interaction. Sometimes they want to tell you about their school, and our parent partner or our child partner connected some of the questions that we were asking to what they were learning as a part of their school curriculum. So I think really, I don't know, it sounds so basic, but really listening to kids about what it is that they want to get out of it and trying to incorporate that as much as possible.
That's a really great question. Thank you for posing that, Andrea. And I see, Michelle, you have your hand raised. Would you like to unmute yourself?
Yes, hi. I just wanted to add to Michelle's comment. So I'm a mother of a child with medical complexities, and she's 16, and her sibling, my son, is 14, and his reasons for engaging in research is interesting because he really feels like sometimes he doesn't have a voice and everything. There's a currency for attention. We give our daughter so much attention, and him being involved in research is a real way for him to share his opinions and someone to be like, "Oh, you're listening." He's like, "People are listening to my opinions," and it really helps his identity as a sibling. So just wanted to add that.
Thanks, Michelle.
Thanks for sharing that, Michelle. Really appreciate it. We have a couple minutes left. I actually want to pose a question myself to the presenters. There were some sprinklings of this throughout your presentation, as well as in your responses to other questions on the call today. And maybe it's just more explicitly calling it out in terms of what the most rewarding thing has been for you about doing this study, and also what impact are you hoping it to have?
You want to go first, Logan?
Sure. I mean, I don't think I think you know best about how it's going to impact folks, but I think I can talk from my own experience about how important it has been for me to partner on this project because I think it very much aligns with my passion and professionalism in terms of equity, diversity, and inclusion. And I'm just, as I said, I'm just really grateful for that connection between the two things, because I think this is the first time that I've actually connected those two things within within the research space. And I think it has opened up new career doors for me personally. So, I'll leave it to you, Michelle, to talk more about the study itself.
Yeah. I think there's something really rewarding about just being a member of this team. Like, it's such a highly passionate team of people who really care about one another on personal and professional um, levels. And it's something special to be a part of that we don't always see. It's always like agenda in academia. So, this other way of relating to one another, I feel lucky to be a part of that. And in terms of what I hope we can achieve, is the thing that brings us together, right? People are so passionate about trying to increase opportunities for people who tend to be left out of research partnerships altogether. And the trickle down, coming back to my clinical place, is that these are the same families who have difficulties accessing services or engaging in care. So if we find better ways to increase their participation and partnership upstream in the design, development, evaluation of services, I think ultimately it's going to help those communities to receive more equitable service.
Excellent. And Gail, I see that your hand is raised. Go ahead.
Hi. Thanks for a great talk, Logan and Michelle. It's really nice to join. And Michelle knows that I share that passion for this topic. I guess one of the things I just wanted to add to some of the conversation about, especially involving younger children. I agree with all of the comments made. I think the piece that I want to really add and emphasize that has been my own learning in working together with younger children is that above all else, they are bringing expertise. They have very, very specific expertise developed often over years of immersion in, whatever the topic is. That's why, for example, they've been, brought together as part of the team. And I think that for me, that's the piece that always brings me back to trying to think through navigating, for example, the ethical issues involved and some of the ways that we try to think about what does it actually mean to try to form partnerships and how can we ensure that the input of advisors is actually consequential, like that it makes a difference, it's given weight. And I think those continue to be concerns when we're engaging children because of so many assumptions. But I think in my work, bringing what's called a childhood ethics lens to the front is a huge help. And even if you're not necessarily calling it that, I think your presentation today shows that you're both doing that and your team in your work as well, because still there are just so many assumptions that discredit what young people have to say and also their actual knowledge and experience in particular areas that we might be researching. I'll thank you anyway. I'll leave it there.
Thanks, Gail. I appreciate that perspective and also thinking about a rights-based lens that children have agency and the right to inform their own life experiences, but very often aren't given those opportunities.
All right, we have time for one more comment, which I see, Michelle, your hand is raised. Please feel free to unmute yourself.
Yeah, I just had one more question for the team and possibly Gail or anyone who wants to chime in. Because I've noticed, have you noticed that there are nuances between involving children, involving teenagers, not quite graduated, not like 12 to 16, probably, so maybe 17, and then youth, like people who are under 25, but over 17 or 18. With my son, he's taking the youth engagement course, and he's really noticing a difference between the youth who he feels is an adult, like a 22-year-old. He's like, that's an adult, but he's not quite a child. So I'm wondering if there's any insights that you've learned.
Logan, do you want to? I feel like you're more involved than me in the youth space.
Yeah, like and that's an important point that your son brings up because I think we're having lots of conversations within the YER course about the differences in dynamics, and we've had lots of team discussions, but also I think a lot of other students are noticing those differences in team dynamics and are trying to navigate um, how to have conversations with their peers, especially when it comes to um, giving each other feedback because of the different levels of experience they have in both participating and partnering in research. Um, and I don't necessarily have any solutions to those conversations yet because those are just coming up, but there is a bigger difference than we originally thought within the relationship dynamics within both um the student teams um and even the instructor teams, to be fair. So that's a really good point to bring up.
Anything to add, Michelle?
Yeah.
No, I think children are, oh, I don't know which Michelle. Sorry, Michelle W.
So many Michelles. Apologies. Michelle, if you'd like to go first, and then I'll go Michelle Phoenix. Okay, sorry about that.
Yeah, I just didn't notice it. Like I didn't realize it. I think we assume like I feel like it's more like it's closer to a child, but like maybe going a tiny bit faster, like because you can get the information faster. But I feel like it's almost closer to a child when they're in that teen spot, just because of the way that adults treat people in high school. You're still very like I have to do as I'm told. But that's all I wanted to say.
Thank you, Michelle Phoenix. Is there anything you would like to add?
Just to say that we're learning a lot about the difference between child and youth because of the project that Logan and Ali are leading for the Childbirth Training Innovation Fund. So we had a lot of conversation. Can we create one module that covers both children and youth? And ultimately we landed on no, because of some of the nuance between children and youth, both as people who might take and use the module, but also the ways in the content. So, how do we engage differently with younger children versus youth?
Perfect. Well, we're a few minutes over time. I want to thank our speakers for joining us today and leading us in a wonderful presentation about their incredible work. And certainly we have lots to look forward to with other work that they are leading and championing, such as that course Logan's a part of. I know I certainly am looking forward to it. For those on the call, I'd love to thank you also for joining today's community engagement series. We certainly look forward to seeing you at our next event in May. So please stay tuned for those details that'll be released in our upcoming newsletter. Have yourselves all a wonderful, wonderful day. Bye now.